When most people hear the word hospice, they don't think of support. They think of the end of everything. And that reaction didn't come from one moment. It built over time from culture, medicine, and misunderstanding. I am Nurse Rupal, a registered nurse specializing in hospice and palliative care. Today, I want to walk you through something I see all the time: the stigma around hospice care, where it came from, and why it still affects families today. Most people trace modern hospice care back to British physician and nurse Cicely Saunders. In 1967, she founded St. Christopher's Hospice in London. She introduced a concept called total pain. The idea that care at the end of life should not just focus on disease, but also addresses emotional pain, social pain, and spiritual suffering. When hospice came to the United States in 1970s, it grew alongside a shift in medicine, away from only aggressive treatments and toward more patient-centered care. But from the beginning, hospice was seen as going against the traditional medicine, and that shaped how people perceived it. So how did the stigma build? It didn't come from one place. It came from several. First, medicine's long focus on fighting death. For most of the modern history, success meant curing illness or prolonging life. Death started to feel like failure. Hospice, which accepts that death is approaching, can feel like the opposite of what medicine is supposed to do. Second, late referrals. For many years, patients were only referred to hospice in the final days, weeks, or even hours. That created a strong association. Hospice equals death. And this is where many families formed their first impression. Even though hospice can begin much earlier, that pattern shaped how families sees it. Third, cultural discomfort with death. Over time, death moved out of the home and into the hospitals. Families became less familiar with natural dying process. Conversations about death became uncomfortable, even avoided. And hospice, which openly talks about it, collides with that discomfort. Fourth, the language we hear. Many families are told there's nothing more we can do right before hospice is introduced. That makes it sound like care is stopping, like medicine is stepping away. So hospice gets linked to the abandonment, even though it's actually adding support and a different type of care. Fifth, fear of losing control or hope. Families worry that hospice means no more doctors, no more treatment, no more hope. But in reality, hospice increases support by bringing in the whole team and providing holistic care. It doesn't take away anything. Sixth, policy and eligibility. In the US, hospice is usually offered when a treating physician estimates the life expectancy of about 6 months or less. That rule unintentionally reinforces the idea that hospice is only for the very end, even though prognosis is uncertain and patients can live longer. The good news is things are starting to change. There is more awareness now around the quality of life at the end of life. Palliative care is growing and starting earlier, even while curative treatment is still going on, and we captured that in our previous episodes. Hospice is increasingly accepted when aggressive treatments are no longer working. And what we are starting to see more often is this: patients in hospice can have better symptom control, less suffering, and sometimes even live as long or longer than those receiving aggressive treatment. But even with that, the old beliefs are still deeply rooted. So what can families actually do with this? If someone you love has a serious illness and treatment is no longer working, don't wait for a crisis to ask about hospice. You can bring it up yourself. Ask your care team, is this a situation where hospice could help us now? If hospice is being offered, ask what the team looks like, who will come to home, how often, and what symptoms can be managed. You are allowed to understand the plan completely before any decision is made. If your family is at this stage where hospice has been mentioned, but things still feel unclear or overwhelming, you can ask for a hospice consult so a member of that team can come and explain. Or that's something I provide to patients and families one-on-one. We talk through what you're seeing, what your options look like, and how to prepare for your next conversation with your care team. You can learn more at nurserupal.com. If this helped you see hospice a little more clearly, consider subscribing, because these are conversations most families don't get early enough. And if you know someone going through this, share this with them. It might help more than you realize. In the next episode, we're going one step further. What good clinical practice actually looks like inside a hospice team. What should families expect? And what does quality care really feel like? I will see you next episode.